18 points of the hand Shaoyin heart meridian, 9 on each side, 8 on the medial aspect of the upper limb, 1 at the midpoint of the axilla. The first point, heart 1, 极泉. 极, a summit, is the highest point, and the beginning of the water source is known as the spring. Heart 1 is the highest point and the beginning of the heart meridian, and meridian qi is analogous to water rushing from a spring, so the point is called 极泉, summit spring. Location, in the axilla, in the center of the axillary fossa, over the axillary artery. Location method, the point is located with the patient's arm abducted. First, along the inner side of the biceps, you can feel the branchial artery. It is the continuation of the axillary artery, and the pulse of the axillary artery can be touched up to the apex of the axilla. Indications: first, cardiac pain, palpitations. The second, axillary and hypochondriac pain. The third, shoulder and arm pain. Manipulation, needle 0.5 to 0.8 cun perpendicularly, avoiding the axillary artery. Slightly local soreness and distension should radiate toward the forearm and fingers. And the arm may twitch 3 times, especially in stroke patient, indicating that the stimulation is appropriate. Scarring moxibustion is not suitable. Precautions: when the arm is abducted, the axillary vein is anterior, the branchial nerve plexus posterior, and the axillary artery in the middle. Therefore, one finger must be used to palpate the pulsating axillary artery and gently press the neurovascular bundle toward the back, while the other hand inserts the needle in front of the finger to prevent injury. Avoid harsh lifting and thrusting, which can pierce the axillary vessels and cause internal bleeding. Heart 3, 少海. This is her C point. 少 refers to the hand Shaoyin meridian. Hai means sea. This point is the Hercy point, so it is called the sea of the Shaoyin meridian. Location, on the posterior medial aspect of the elbow, just anterior to the medial epicondyle of the humerus, at the same level as the cubital crease. Location method, with the elbow flexed. The point is located at the midpoint of the line connecting the medial end of the cubital crease and the medial epicondyle of the humerus. Indications: first, heart pain, vomiting. The second, shoulder, armpit, hypochondriac pain. The third, pain in the arm and elbow. Manipulation, needle 0.5 to 1 cun perpendicularly. Heart 5, 通里. As we have mentioned before, this is a road connecting point. 通 means to communicate with. 里 means one's home village. Thus, Heart 5 as the road connecting point, the name of the point means the place where qi returns to the home meridian. Location, on the posterior medial aspect of the forearm, radial to the flexor carpi ulnaris tendon, 1 cun proximal to the palmar wrist crease. Indications: first, cardiac pain, palpitation. The second, sudden loss of voice, stiff tongue causing inability to speak, swollen and sore throat. The third, pain in the wrist and arm. Manipulation, needle 0.3 to 0.5 cun perpendicularly. Heart 6, 阴系, C cleft point. Yin refers to the hand Shaoyin meridian. Xi means cleft, referring to the deep region where qi blood gathers. This is the C cleft point, so it is called Yin cleft. Location: on the posterior medial aspect of the forearm, radial to the flexor carpi ulnaris tendon, half-turn proximal to the palmar wrist crease. Indications: first, cardiac pain, palpitation. The second, bone steaming heat, night sweat. The third, spitting of blood, nosebleed. As a C cleft point of Yin meridian, it is always commonly used to treat blood syndrome. The fourth, sudden loss of voice. Manipulation: needle 0.3 to 0.5 寸 perpendicularly. Heart 7, 神门. This is the most important point of this meridian. It is shoestring point and also yuan source point. Shen means spirit. The heart is the monarch of all organs and the palace of the spirit. This point is the gate where heart qi exits and enters. Commonly used to treat spirit disorders, so it is called spirit gate. Location: on the posterior medial aspect of the wrist, radial to the flexor carpi ulnaris tendon, on the palmar wrist crease. Location method: with the patient's wrist bent, the point is in the depression radial to the proximal border of the pisiform bone, on the palmar wrist crease. Indications: first, insomnia, poor memory, dementia, depressive and manic psychosis, epilepsy. These are all mental disorders. The second, cardiac pain, palpitation. Manipulation: first, needle 0.3 to 0.5 寸. The second, needle 1 to 1.5 寸transversely upward, penetrating heart 4. There's a case for heart 7. A 41-year-old woman suffered from palpitations and insomnia for 2 years. In recent 2 years, the patient gradually developed symptoms of dreaminess and less sleep caused by anger and overthinking. She felt cranky thinking, feeling scared, palpitations, and feelings numbness all over the body, sometimes twitching, shortness of breath, dizziness, abdominal fullness, loose stools, easy to get hungry, and still feel empty in the abdomen after eating. Prefer drinking hot drinks, stomachache and vomiting acid when eating cold, swelling all over the body, pale complexion, pale tongue with white coating, deep and slow pulse, no effect after taking traditional Chinese and Western medicine. Diagnose: palpitations and insomnia, heart and spleen deficiency. Treatment should be nourish heart and spleen. Use tonifying manipulation after needling on heart 7, 神门, and spleen 6, 三阴交. Give treatment every 1 to 2 days. After 2 treatments, palpitations, insomnia, and abdominal fullness relieved, and not too easy to get hungry. After 7 treatments, the patient feel all recovered. Totally received 12 treatments. 3 months follow-up showed the symptoms disappeared after treatments. Heart 9, 少冲. It is 颈 well point. 少 also refers to the hand Shaoyin. 冲 means surging. This is the 颈 well point, where heart meridian qi rushes out to interact with the hand Taiyang meridian, so it is called surging Shaoyin. Location: on the little finger, radial to the distal phalanx, 0.1 cun proximal lateral to the radial corner of the little fingernail, at the intersection of the vertical line of the radial border of the nail and the horizontal line of the base of the little fingernail. Indications. First, cardiac pain, palpitation, vexation. Second, psychosis, coma. As all the Jingwell point does, it can treat coma patients. The third, fever, heat sensation in the palms. Manipulation. First, needle shallowly 0.1 to 0.2 cun to produce local distension and pain. The second, bleed with a 3-edged needle. So much for today. Thank you.